Hello and welcome to this SafeWork New South Wales webinar. The title of this session today is Mentally Healthy Workplaces. And this is one in a series of webinars specifically designed to help construction site supervisors to understand the importance of their roles and the major impact they have in maintaining safe and productive work sites. My name is Gary Colthorpe and I'm a Senior Inspector with SafeWork, and I'll be co-presenting this session today with Assistant State Inspector Stephen Charles. Thanks for joining us today, Steve.
Yeah, thanks, Gary. It's great to be here.
It certainly is. And Steve and I will alternate between us as we take you through this session today. Okay, so let's make a start by looking at the topics that we'll cover in this webinar. Firstly, let's look at why mental health matters in the workplace. Then we'll consider the actions you need to take to create a mentally healthy workplace. We'll also look at what are you required to do by law. What are your responsibilities for managing both physical and psychological hazards at work? And we'll consider the benefits of creating a mentally healthy workplace. We'll review some of the statistics relating to mental health in Australia, and we'll discuss the psychological risk factors that affect mental health in the workplace. So let's look at why mental health matters in the workplace. Why is it now considered to be such an important issue? To do this, we need to consider some of the key characteristics of our working life, like time. Most of us spend a third of our waking life at work. It's an important part of our life. And purpose. Our work gives us a feeling of purpose, and it has a considerable effect on our mental health, either in a positive or a negative way. As well as safety, because working in a healthy, safe workplace and doing meaningful work also helps to prevent mental ill health. And worth. Our work gives us a sense of worth, where we're challenged to do great things, meet new people, stay socially connected, and encounter different ideas. There are both social and financial benefits for working in a mentally healthy workplace. Of course, income. Our work gives us a livelihood and a sense of independence. Mentally healthy workplaces encourage the prevention of mental ill health and connect workers to support services. And research has found that mental healthy workplaces create a more engaged, robust and productive workforce. Steve and I will now take you through how to create a mentally healthy workplace. Thanks, Steve.
Yes, that's what we're going to look at now. What's involved in creating a mentally healthy workplace? In a mentally healthy workplace, psychological risks are identified and effectively managed so that employees feel respected, supported, and free to speak about mental health concerns. There are some simple action steps you can take to create a mentally healthy workplace. Some are quick and cost-effective to introduce, while others require greater investment and do take more time. Firstly, it's important to understand that in order to achieve a mentally healthy workplace, an organisation's leadership, including managers and supervisors, must show genuine commitment to establishing and maintaining a supportive and inclusive culture and to lead by example. A key characteristic of leadership includes finding out how your business is tracking in being mentally healthy. There are useful resources available through the SafeWork New South Wales website to assist you with this, including the People at Work tool, which provides a free psychological risk assessment of your organisation. Just type in People at Work tool into the search bar and follow the People at Work process. You can also type mental health at work into the search bar to complete a workplace wellbeing assessment. The New South Wales Government Workplace Pulse Check site also provides a comparison with how mentally healthy your workplace is compared and others at the same size within the same industry, and gives practical actions to take to improve your workplace. Some other key characteristics of leadership committed to creating a mentally healthy workplace include empowering everyone in the workplace by providing adequate resources and ensuring that they understand their legal obligations, acknowledging workers' achievements and encouraging their career development so that they feel valued. This is very important. Supporting workers through workplace uncertainty and change. Implementing work practices that support mental health. And talking about mental health openly and often to help reduce the stigma around it. And 2, leadership in creating a mentally healthy workplace also includes identifying the factors impacting mental health in your workplace, which can determine through a systematic risk management approach and through consultation with workers. The first step in the risk management process is to identify the psychosocial hazards which could arise from the work to be carried out in the workplace. This involves reviewing all aspects of the work that could potentially harm people and determining the hazards and risk involved, and then implementing controls to eliminate or minimise the hazards identified. The process should be fair and transparent and ensure that workplace behavioural standards are understood and upheld, and all workers are aware of their legal duty not to cause harm, either physically or psychologically, to themselves or others while at work. By typing mental health into the Safe Work New South Wales website search bar, you can access the code of practice for managing psychological hazards at work. This code contains information about how to take a risk management approach to identifying psychological hazards, with suggested actions to follow, as well as confirming the importance of consultation. Consultation can occur in a number of different ways, such as regular surveys, focus groups, workshops, or one-to-one conversations. Keep in mind also that regular analysis of your human resources data will help you to identify the frequency of unplanned leave, workers' compensation claims, access to support services, and reports of bullying and harassment, and provide good insight into the prevalence of the psychological risk factors in your workplace. Leadership also includes taking action and leading change. To assist with this, the information gathered through your risk management process and human resource data should be put into an action plan. This plan will help you to ensure that you stay on track and the identified risks are mitigated. Your plan should contain specific and activated initiatives and actions that can be measured and monitored. Taking action includes giving feedback to workers and managing their performance, including around inappropriate or harmful behaviours, as well as dealing with differences of opinion and disagreement and taking disciplinary action when required. Leadership includes taking a zero tolerance approach to workplace bullying, discrimination and harassment, to prohibit behaviours like abusive or humiliating comments, aggression, or unjustified criticism and complaints. Effective anti-bullying policies with clear reporting and quick response processes should be introduced and promoted by leadership. And violence and aggression at work, including physical abuse and assault, or any threat or violent behaviour from clients, members of the public, or other workers, must be prohibited. Consult with your workers to identify risky situations and discuss changes in where and how work can be done to minimise risk.
Workplace mental health is everyone's responsibility, and good leadership will inspire workers to participate in activities that promote mental health in the workplace. You may also choose to establish a team of mental health champions who are passionate about taking specific action to achieve and maintain a mentally healthy workplace culture. So still looking at actions you can take to create a mentally healthy workplace, let's also consider the value of promoting mental health and wellbeing at work and supporting workers when they need it. If you suspect someone isn't coping, be supportive through reassuring conversations and link them to resources where they can get further assistance and support. Workers experience stress when they perceive the demands of their work exceeds their ability to cope with the resources available to them. As we'll see in the upcoming slides, business leaders, managers and supervisors have a legal obligation to manage the exposure of work-related factors that increase the risk of stress to workers. The aim should be to eliminate or minimise your workers' risk of harm from any potential stress at work wherever possible. And providing access to support services. You don't have to be a mental health expert to support your workforce. All it takes is the ability to notice when things aren't right, starting a conversation to check in, and connecting them with support services. If you notice changes in your workers' productivity, mood, behaviour or appearance, then that can be a sign that they need support. If you're concerned about anyone at the workforce, it's important to take early action. The Are You OK website has great ideas about how to start conversations about mental health. It's also important that your employees know how to make contact with mental health support on their own if they need to. You may consider ideas like putting mental health literature in your lunchrooms, on your lunchroom notice boards, or at entry to the site. Support services may include your own workplace employee assistance program or one or more of the many external mental health support programs, like Mates in Construction, the Black Dog Institute, Beyond Blue, Lifeline, Men's Line and Headspace, for example. Details of each of these services can be found by simply typing the organisation's name into a web browser. Let's now look at ways of working to support mental health. Stay in touch with any workers that may be on leave due to mental ill health and keep them involved in a return to work process.
And create a positive workplace culture, which starts with ensuring everyone is treated with respect. A mentally healthy workplace culture is one in which your workers feel valued and that it's okay to ask for support. Everyone is contributing to a culture where people feel safe and supported to talk about mental health, and diversity and differences are accepted and celebrated. You can discover if your workplace culture is on the right track and learn about how to improve it with the resource kits available through the New South Wales Government Mental Health at Work website. The guides available can help you to recognise what your workplace might look, sound and feel like when there is a great culture in place. You can also download the iCare Select Connection Toolkit to confirm how to create a socially connected workplace. Continuing to look at actions you can take to create a mentally healthy workplace, let's consider the need to raise awareness throughout the workplace. You can do this by increasing knowledge of mental health and mental ill health throughout the workplace, as well as educating managers, supervisors and workers to understand just how common mental ill health can be. the contributing factors and simple steps to take to look after yourself and support others at work. Education and training in the workplace improves understanding about mental health and can also include improving attitudes and language about mental health, encourage people to seek help early, provide skills to take care of your own mental health, and ensure early signs are more easily recognised and responded to if a colleague needs support. Be prepared to introduce or revise your workplace training. Include the provision of mental health and wellbeing training for employees to increase knowledge, confidence and skills for supporting one another at work. Mental health training can help in identifying signs of mental ill health and provide the confidence to start a conversation and provide appropriate support. Mental health training teaches you how to provide the right support at the right time, which is important because our mental health needs change. There are some very useful mental health training options and materials available online through the Safe Work New South Wales, the New South Wales Government and numerous other organisation websites. Can include your Mates in Construction website and Heads Up website. Just type workplace mental health training into your web browser to access these. Policies and ways of working may also need updating to include mental health considerations. Ensuring that you have clear mental health and wellbeing policies, strategies or processes can help you meet your obligations under the WHS legislation. Ensuring that you have clear mental health and wellbeing policies, strategic or processes can help you meet your obligations under the work health and safety legislation and create a work environment where your team feels supported and valued. Having mental health and wellbeing integrated into your policies and procedures will help everyone understand the expectations around the behaviour, reporting and support and demonstrate leadership commitment. Mental health action plans and policies will work best when they're clearly and effectively communicated to everyone in your workplace. Be sure to include discussions around mental health and the policies, procedures and support available in induction training, for example. And monitor the workload of your employees regularly to ensure they are not having to work excess hours to get their work done. You can do this by discussing workload in one-on-one, catch-up and team meetings so tasks can be shared fairly. Setting realistic work schedules, clearly prioritising tasks and promoting flexibility where possible, and making adjustments to roles or tasks as required. Ensure access is available to tools and resources for managers, supervisors and workers to learn skills to stay mentally healthy.
Be sure to monitor workloads. Check for good work design and clear job descriptions. One of the best ways to prevent workplace ill health is to design jobs, work procedures and environments that are healthy, safe and productive. Good work design is all about creating work that reduces the impact of hazards. Good work design supports everyone to do their best at work, leading to job satisfaction and higher productivity. To achieve good work design, make sure as much as possible the work is appropriate for the worker's experience and skills, is achievable given the workload and the resources available, is reviewed continually in consultation with your workers. There is good work guidance information available online for good work design through Safe Work Australia. Type 10 principles of good work design into your web browser. Information available through the Heads Up website offers practical advice on what to consider when developing work roles. Everyone at work needs to know what is expected of them. This helps workers to feel productive, motivated and engaged. You can achieve role clarity by making sure team members know their job requirements and responsibilities, the outcomes they must achieve, how their role fits into the organisation structure, who they report to. You should also have clear job descriptions, work inductions, and opportunities for training and development. Having a good understanding of what is expected of you at work each day helps workers to feel productive, motivated and engaged. Role clarity is about ensuring that everyone in your workplace understands what is expected of them and how their work will be assessed and by who. This helps to reduce worker stress and confusion. And finally, consider how you can adjust work to be safe for mental health, with realistic and flexible work schedules where possible. By being flexible in the way work is delivered, you'll support the needs of your team and create benefits including improved work-life balance, increased productivity, reduced absenteeism, and improved morale. Flexibility can include arrangements, such as looking at opportunities to vary daily or weekly working hours, or maybe start and finish times, staggering rosters, considering part-time or job share roles, working from home or working remotely. Information on flexible working arrangements is available through the Fair Work Ombudsman, available online. When psychological hazards and risks at work are not effectively managed, they may increase the risk of work-related injury, incidents and errors. Ensuring a systematic approach to managing psychological hazards and risks will help PCBUs and duty holders to meet their work health safety obligations. It will also decrease organisational disruption and costs resulting from related harms, and may improve work health safety and other organisational performance and productivity. Steve will now take you through what the legislation says about your responsibilities with respect to managing mental health in the workplace. Thanks, Steve.
Before we go through the next few slides, we have a bit of a disclaimer. This is where we'll talk about some key clauses in the legislation, and we're just going to mention the highlights and paraphrase rather than quote the legislation word for word. This is not legal advice. We're just trying to help you understand a number of the key responsibilities that you need to be aware of in your role as a supervisor. To review all of your legal responsibilities and the full detail on these requirements, you'll need to look up the Work Health and Safety Act and also the Work Health and Safety Regulations 2017, which are both available online. In these next few slides, where we'll see reference to health and safety, we need to keep in mind that Section 4 of the Work Health and Safety Act defines health as including both physical and psychological health. This means that a person conducting a business or undertaking, who we can refer to as a PCBU, and for the purpose of our discussion today, we can think of as being an employer or a business owner. They must ensure both the physical and psychological health and safety of workers engaged by them, which we will look at in more detail on the next slide. We will see in the next few slides that the legislation uses the phrase reasonably practicable when referring to duty holder responsibilities. So Section 18 of the Work Health and Safety Act confirms that reasonably practicable in relation to a duty to ensure health and safety means that which is reasonably able to be done in relation to ensuring health and safety, taking into account and weighing up all the relevant matters, including 1, the likelihood of the hazard or the risk occurring. 2, the degree of harm that might result from the hazard or the risk. And 3, what the person concerned knows or ought reasonably to know about the hazard or the risk and ways of eliminating or minimising the risk. And 4, the availability and suitability of ways to eliminate or minimise the risk. And 5thly, whether the cost associated with available ways of eliminating or minimising the risk is grossly disproportionate to the risk. Section 19 of the Work Health and Safety Act details the primary duty of care responsibilities that a PCBU must demonstrate. So a PCBU has a primary duty of care to ensure, so far as reasonably practicable, the health and safety of workers, and also to ensure that other persons are not put at risk from work carried out arising from the business or undertaking. And in relation to both physical and psychological health, a PCBU must ensure, so far as reasonably practicable, 1, the provision and maintenance of a work environment without risk to health and safety, and 2, the provision and maintenance of safe systems of work, 3, the provision of and access to adequate facilities for the welfare of workers at work, and 4, the provision of information, training, instruction or supervision necessary to protect all persons from risk to their health and safety, as well as 5, that the health of workers and the conditions at the workplace are monitored for the purpose of preventing illness or injury. Section 16 of the Work Health and Safety Act 2011 also makes it clear that more than one person can have the same duty, and each duty holder must comply with that duty even if another person has the same duty, and that if more than one person has the same duty, each person retains responsibility for it and must discharge it to the extent that they have the capacity to influence and control it. So what does this mean for you as a construction site supervisor? It means that if you have the capacity to influence and control health and safety on site, then you have the legal duty to do so, irrespective of whether someone else has the same duty. And although roles and descriptions for supervisors may differ from site to site in relation to the task they perform, every supervisor has responsibilities when it comes to work health and safety because of their ability to influence and control it on the work site. No one in a supervisory role on a work site should ever say that it is someone else's responsibility to manage health and safety if they have the capacity to influence and control the situation. Research indicates the following benefits for workplaces that promote positive and mental health. 1, a return on investment of approximately $4 for every dollar spent on promoting positive mental health. 2, leads to a healthier and more engaged workforce. 3, it increases work quality and productivity. 4, as well as attracting and keeping good workers. Keeping good workers for longer periods not only reduces workplace costs, it also is important for retaining organisational knowledge, skills and experience. Research indicates working in an environment that is mentally healthy is the second most important factor when looking for a job. Workplaces that promote positive mental health can also expect a positive workplace culture that brings out the best in everyone and so benefits the business. Reduces the instance of absenteeism, where workers stay away from work due to feeling mentally unwell. Reduce the instance of presenteeism, where workers are being less productive due to feeling mentally unwell, which is also a very unsafe situation, as a worker may be unable to concentrate effectively at their work. And reduce rehab and workers' compensation claims costs. The benefits for workers. Workers also have an important role to play in creating a mentally healthy workplace where they and their co-workers can thrive. Workers may or may not be experiencing mental ill health, but can still benefit from working in a positive and supportive work environment. Mentally healthy workplaces can provide workers with many benefits, including 1. It builds their confidence. 2. It's a feeling of belonging and financial security. 3. Gives a sense of purpose and achievement. And 4. Provides that social connection and networks. A mentally healthy workplace will also make it easier for those in need to get the support they need to get better, alleviate their symptoms, continue to enjoy the benefits of working, and boost their mental illness. Workers in mentally healthy workplaces are able to access counselling services and mentally healthy and wellbeing programs and resources, as well as peer-to-peer support and recovery at work information. Gary will now discuss some interesting statistics relating to mental health. Thanks, Gary.
In these next couple of slides, we'll look at some interesting statistics relating to mental health. More than 500,000 New South Wales workers, that's approximately 275,000 men and 290,000 women, have poor mental health. This means that on average, 1 in 6 people are experiencing mental ill health. And the estimated cost to New South Wales of mental ill health at work is $2.8 billion per year. In addition to this, approximately 45% of Australian adults will have mental illness at some point in their life. It's quite likely that an Australian adult will either experience mental illness or need to support someone with mental illness at some time. And if unaddressed, mental ill health can have long-term impacts on the individual's mental health, quality of life, and financial independence, which then can in turn impact their family and community. The average time taken off work for psychological claims is 224 days, compared with 50 days for physical injury. And the cost per psychological injury claim is 4 times higher. There are common psychological risk factors that can impact workers' mental health and physical health in the workplace. These may apply across the organisation or have greater impact on particular roles, occupations or workers. Psychological hazards are anything that increase the risk of stress at work, including role overload or underload, where people are overworked or are underworked, where workers have experienced a traumatic event. There is role conflict and a lack of clarity, where the workers have low job control, or there is poor relationships between workers, supervisors and managers, or poor levels of support are offered to the worker by managers. There's a lack of worker support, or where workers are exposed to workplace violence or bullying. Let's consider a situation where high job demands might occur, where there's a lot to get through in any particular day in a short time frame. If the day's schedule is going to be really tight and you're trying to meet a deadline, you'll need to plan ahead and consult with workers on how the job can be done safely. Have a conversation up front with the workers so that they understand that they're supported and that they stay physically and psychologically supported through the day. Other common workplace factors that can impact workers' mental health and physical health include where there is exposure to workplace harassment, or there is inadequate reward or recognition offered, or we're working in hazardous physical working environments, or working in remote or isolated locations, if poor procedural fairness exists, or poor work change management occurs, where there are workplace conflicts or poor working relationships, or when workplace aggression occurs. These hazards can increase the risk of work-related stress and, if left unattended, can lead to psychological injury. Psychological risk factors also lead to a lack of concentration, poor productivity, and impact work and personal relationships. Having an awareness of these hazards and how they occur in the workplace can help you to take action to manage them and create a positive workplace culture. You need to keep in mind that people may perceive and respond to the same psychological hazard differently, just as they may with physical hazards. When managing psychosocial hazards, it's important to take into account tasks and activities that may increase risk to a particular group of workers. For example, young or older workers, new workers, workers with diverse language, literacy, numeracy or cultural backgrounds, or whether they have experienced injury previously from traumatic events. Steve will now discuss our podcast series and how to get in touch with Safe Work New South Wales. Thanks, Steve.
Yes, we want to take the opportunity to tell you about our podcast series, also known as Safety Casts. These podcasts are available for different work health and safety topics in construction, including scaffolding, electrical safety, and working at heights, just to name a few. There's even one on women in construction. They involve safe work inspectors discussing these topics and also contain information about additional resources available to the industry. As well as watching our other webinars in this supervisor series, we encourage you to tap into this additional Safety Cast resource, as they're great for toolbox talks with short, sharp messaging. And they're also available online and on many media platforms and apps, including Spotify and Apple Play. Simply search for Safe Work Safety Casts in your search engine to access the latest of these podcasts. There's also a large amount of guidance material available through the Safe Work New South Wales website. This material will assist you to understand how to maintain high standards of health and safety on your work sites and also reduce workplace injuries. We encourage you to access and read through this information. Simply visit the Safe Work New South Wales website and type your topic search into the search bar. And our Speak Up app allows you to advise us of any unsafe workplace activity you may encounter, and you can remain anonymous. You can also download this app through the Safe Work website. It also enables you to take photographs and upload those photographs as well. And in wrapping up this webinar, we'd like to remind you that you can also always contact us on 13 10 50 to seek advice, report a health and safety concern, or just to speak to an inspector about any health and safety matter.
Well, Steve, I believe that's a wrap. Thanks for joining us today, and thanks to everyone who attended this webinar.
Yeah, thanks, Gary. And thank you for joining us today, everyone. And we hope to see you again soon.